Jordan.
Hello. Hey everyone, we're going to go ahead and get started. Thank you all for coming tonight to part 3 of our public health informational session. This one is public health resources, so we have different local agencies here that are going to talk to you about resources they provide. I'm Phil Gurley, I'm a community involvement coordinator, and then we'll have time afterwards for Q&A. And as in previous sessions, we'll have a mic to pass around for Q&A. And again, the mic is just to help for our recording, so when they're available online and you share these with family, friends, folks can see and hear everything. So yeah. All right, so I'm going to pass it to Wes first to kick things off.
All right, thank you, Phil. I wanted to say thanks to Phil and for Mark for putting these sessions together. I think it's great. Gives everybody an opportunity to come together and get all your questions answered at one time and bring some subject matter to the floor that I think is important to a lot of our residents in our community. So appreciate you being here. I'm Wes Vins. I'm from the County Health District, and so probably our primary role at this point in the response is the groundwater sampling that we're doing at the private residential homes. And so that continues. We had 2 teams in the field today. They had, I think, 10 wells scheduled for today. We accomplished 8 to 2 canceled. There have been some folks that we've sampled multiple times, so we're into the 4th round of sampling in some cases. Other places, only the 2nd round of sampling. So we continue the sampling. And I want to make sure everybody here knew, so you can tell your neighbors and your family that we continue that sampling program. And if you want to get on the list to get sampled, you can call the phone number. It's 330-849-3919, and that'll get you on the list to be sampled. That's correct. Yeah. So there's really 4 priority areas or target areas at this point. There is a 5th area, which is the outer area outside of those priority areas that we started with. The area 5, people are still welcome to call in if you're in area 5, but at this point we're only sampling areas 1 through 4. Recently there was an expansion of that area. I think Laura might have talked about that. Laura Faust from our office gave a really nice presentation maybe a month ago, I think, on the groundwater sampling program. But if you have any questions about that, we have it on our website. You can go to our columbiana-health.org website. You can get a lot of the information there. Also the phone number, in case you forget for some reason. The phone number to get scheduled for the sampling is also on that site. An important piece to this, Norfolk Southern also collects samples, as does the County Health District. They do go to different laboratories. So our teams collect our samples, their team through their consultants collect their samples, and then they're sent to 2 completely different laboratories. Our laboratory results are posted on our website, so you can actually go and look at water samples that we've been collecting. So that's probably the summary of it. There'll be questions at the end. Is that right, Phil? Yeah. Okay. So I'll turn it over to Dr. Gretchen Nickel.
Thank you. I'm Gretchen Nickel. I am the medical director for River Valley Physicians, which is the group that is working out of the clinic here, which was the clinic that evolved from the original clinic that was in the church. I'm also the chief medical officer for East Liverpool City Hospital, so we've been working closely with the health department in that regard. So just to give you a summary of what we're doing in our clinic that's actually right here across the street, as I said, it evolved from the original church clinic that we had, which at that time we recognized needed more. We needed to have lab availability. We needed to be able to treat certain patients. And in that capacity that we were there, we were getting survey results. We were helping to facilitate patients seeing their doctor, and by the doctor calling their doctor to say, here's what we're finding. But we did see the need to have a permanent clinic here. So we did open the clinic that's located across the street. That clinic is a full service primary care office. So it's not meant just for the purposes of patient seeking care regarding the train derailment, but it certainly is there for anybody seeking services from the train derailment. We're able to do the screenings that have been recommended by the Ohio Department of Health that they obtained through working with their toxicologist. We are also able to get that lab work right there in the clinic. We've been able to also provide services to the first responders in the same way to do surveillance and any lab work that they would need. And again, we are a full-service primary care office, so anybody that is looking to establish primary care can get that there as well. We initially started the clinic on a Monday through Thursday basis and realized that we had a need to be there on Friday as well. So the office is now open Monday through Friday. We have not branched into weekends at this point, but if the need arises, we could consider doing that also. We are currently accepting walk-ins as well. We've been able to accommodate the walk-ins every time that they've needed to see somebody. The only downfall that I can say is, unfortunately, that was a clinic that was put together very quickly, and we needed providers very quickly. And so sometimes we've not had the full providers that we've needed. So we've had to have somewhat lesser hours on occasion, but that seems to be resolved. So if you have heard anything of that nature, it seems to be resolved at this point, and our goal is to be open Monday through Friday and allow walk-ins as well. Really the summary for the clinic, and we'll take questions at the end. Okay, all right, thank you.
Thanks, Gretchen. My name is Tom Andrews, and I'm the CEO for the Community Action Agency of Columbiana County. We provide a multitude of services for Columbiana County, but I'm here tonight to talk about our federally qualified health centers. In East Palestine right now, we have 2 Head Start centers in the elementary school and service those kids and families. What I'm here to talk about is we were, just like Gretchen and the East Liverpool Hospital, we were part of that health assessment clinic. And I don't know if any of you saw our mobile unit. We just got the mobile unit just before the train disaster, and our plan was to go out into the community to offer services. We also offer primary care, behavioral health, dental services, and we have a pharmacy, a 340B, which is reduced cost for people that have medication. A federally qualified health center takes Medicaid, Medicare, takes most private insurances, and if you don't have insurance, we look at your family income and then offer a flat sliding fee scale. So we can help people that can't afford regular health care. We're here to serve the underserved in the community. Right now we have 4 other offices in Columbiana County. The closest to East Palestine is in Lisbon or East Liverpool. We serve about 430 patients from East Palestine. So we've brought the mobile unit here to offer primary care and behavioral health, and we're set up at the church, First Church of Christ on Martin Street. On Mondays is primary care, and on Wednesdays is behavioral health. I have bags in the back with information and a flyer with telephone numbers you can call if you choose to see us. We're trying to build a patient basis so we can help people that don't have good health care, don't have primary care. So we're here as a way of helping in the community. Our agency's been around since 1965. Some of you know about our energy assistance program and others, but I'm not here to talk about that. So I guess we would like to see more patients so that we can have a regular patient basis. So I guess we'll wait till the end. Who's next? Marcy, you're next.
Thank you. Hi, I'm Marcy Patton. I'm the director of the Columbiana County Mental Health and Recovery Services Board. The board is the public entity that oversees behavioral health services in the county. We don't provide direct services, but we work with all the different agencies and different projects. So we've been involved since the train derailment, first at the health clinic, having individuals there and available. And then since then, doing a number of things. We've been the recipient through the state of Ohio of a federal grant that's helping to provide behavioral health services. We're waiting on an extension of that that'll go for another year, and all kinds of additional things will be included in that second grant. With the first grant, we've had some support groups that have been going on. One of our counselors for one of those support groups is here with us tonight, and we've had those going on. Those are just finishing up, but we'll be having additional support groups and things down the road. We also have been doing some outreach events, just trying to let people know what mental health resources and behavioral health resources are available. There's been a number of flyers, and there's some up here on the table that talk about the various behavioral health resources. One of the things that I think has been really exciting not because of, the situation, but we have been able, through both the federal grant and through the railroad, to have a number of services available for free for individuals. So if you have co-pays, if you have deductibles, for behavioral health services, those are covered. Insight Counseling and Wellness has an arrangement with the railroad for that. The Counseling Center, Family Recovery Center, Community Action Agency, we have arrangements through our federal grant. So those costs are covered. So people don't have to have that as a barrier for their services. We're going to be doing a lot of things in the future. This is Diana Fabry. I'm going to let Diana say hi. She is our East Palestine Resiliency Project Director. And through the East Palestine Resiliency Project, we actually have a resiliency center that we're going to be opening. There'll be some additional stress-related things, chair massages, counseling, some creative arts kinds of things, just a lot of different things to help people, trauma-focused yoga, anything that we can do to help alleviate the stress and some of the concerns that people have, because we know that this has been a really difficult time for people, and feeling stress and anxiety and worry is natural. It's a normal thing, and you may have that for an extended period of time, and it's okay to feel those things. It's also okay to talk to somebody about those problems so you can get some help and some relief from those things. So I'll let Diana say hi.
Hello, I am Diana Fabry. I am the director of the project that Marcy's discussing with all of you, which is the East Palestine Resiliency Project. I assume that most of you have probably not heard of it yet, because we really haven't been out in the community too much, but I am doing a lot of outreach, and I am going around from one business to another, just seeing if anybody, could benefit from support groups. So I should be hopefully meeting a lot of you and getting to know everybody, and hoping to provide you all with some support. So I think one thing that Marcy didn't mention, but we are hopefully going to have some events at the garden downtown that Threshold has been using. So we are going to hopefully, have some support groups there at that location, maybe add some additional gardens so that the community can use those, and have some events. So yeah, we have a lot in store, but we are, just getting started. So it's good to meet all of you, and I think that's about it.
All right, thank you again, and please feel free to reach out if there's any needs or things you see, because one of the things with our grants is we're developing this based on what you want and what you need, not what we think is needed, but what the community feels would be helpful to them. So please make sure that you let us know those things.
Good evening. My name is actually Susie Kuzer. I'm Chief Operating Officer for Mahoning Columbiana Training Association, and we operate the Ohio Beach Job Centers in both Mahoning and Columbiana counties. This is Cindy Bresnahan. She's our business service representative as well. So just to kind of let you know, we handle everything that has to do with employment. So if you were displaced or need to find another job, maybe upskill some trainings, we can help pay for school and that type of thing. Cindy works directly with businesses, and she has been out a good bit, and I'll let her talk about some of the things where she's gone and talked to businesses. Our Ohio Means Jobs manager for Columbiana County has actually been setting up at the library twice a month. The next couple weeks he's on vacation, but if anyone was wanting to go in there, we put the dates on the website, and we're able to share with you when we are there. So there's information in the back, and then we also have services for youth as well, in school and out of school. And if there's any individuals who, even youth-wise, that are looking, stuff with school, if they need, we can help set up services for tutoring and for mentoring and for counseling and all of that stuff, and then kind of have just an extra support team to help them along the way if there's any needs there as well. So and then I'll pass this off to Cindy about business.
Okay, so, like Susie said, I work with employers, so I've been, talking to some of the employers, and there's a lot of resources that are in place already that can maybe, help employers, certain grants, and, you know, maybe just different ways of doing business. So, what we do is we do a short interview with the businesses and then maybe connect them to some resources that aren't necessarily, you know, that we've always done. And also help them with their hiring needs, so maybe they've lost some employees due to the derailment. We can also post jobs, so if you know of any businesses that are, you know, maybe can help or benefit from our services, send them our way, and I have my card in the back. Okay.
All right, thank you, everyone. So now we'll go into Q&A, and we will have a mic going around as well. Yes, Jamie?
I would find out, do they do vinyl chloride testing at the clinic or on the van? And if so, do they do it for children? And also, are doctors now allowed to give chemical diagnoses, or are they still under the CDC's recommendation that you don't give chemical diagnoses?
I was never given a recommendation not to give a chemical diagnosis, so I'm not sure what that question means. Actually, our diagnosis is chemical exposure for the screening that we do. We are not checking for vinyl chloride as part of our regular screening. We can check for vinyl chloride, it's just not the part that's recommended, and that is covered through the work with the Ohio Department or the Ohio Department of Health. So we can order a vinyl chloride test, and East Liverpool City Hospital can run that. It just wouldn't be part of the free service that's provided for our patients that were exposed to the derailment.
And I know I was at actually East Liverpool Hospital the week after the derailment, and I have a copy, I'll find it somewhere of that memo that said not to give chemical diagnosis because you can't actually test for chemicals. And that was the diagnosis that they gave me, was an upper respiratory infection. It didn't say anything about the exposure to chemicals.
I don't see, I never saw such a memo, and I certainly was never told not to use a chemical.
And we heard the CDC gave you guys a memo too, not to test for vinyl chloride, because the doctors were saying, and CDC said they didn't. But that's, I'm sorry. And then, are there any services for children through behavioral health? And that was one question. And are there any events being held outside of town for the behavioral health?
The answer to both of those will actually be yes. One of the things that we're working on with the Resiliency Center is it will actually be located outside of the city limits, close but outside, and as soon as we have all the details worked out over the next couple of weeks, that information will be shared. We will be doing a number of events throughout the community. The kids will be involved in. Ohio State University will be working with us as part of that and doing some events throughout the summer and throughout the next years. There's also, counseling available in the schools. I know that the schools have made arrangements for counseling. I think that's through Insight. But again, if you're going to any of the other agencies, those services will be available and the counseling will be open, and some of the groups and the events and things will definitely involve youth and children. So.
Thank you. I think community council needs mental health right now. One last question. Shut up. Are the medical doctors working with the independent doctors that are coming in to kind of information share or map symptoms like Dr. Galam, Dr. Haynes? Are you guys hooked up with them at all?
Nobody has reached out to us regarding that, but they would probably be reaching out to the Ohio Department of Health for that, if they had questions. There was a webinar that got everybody together that wanted to be together throughout the counties, of people who would be expected to be treating patients from here that took place while the temporary clinic was still open, to get that information out to the doctors so they knew what recommendations were. But as far as any other doctors reaching out to ODH, I'm not sure.
Is that something you guys would do, was work together? I'm not sure how that works in different professions.
Oh, sure, so just, if I'm understanding you correctly, if you wanted to come to that clinic and I was the doctor there and you just wanted to have the screening that's recommended, but you have a primary care doctor?
No, I'm saying like Dr. Galam is from California, Dr. Haynes is from University of Kentucky, and they're coming in to do health tracking and health symptoms. And I know one of the things that was said to me is that people don't go to the clinic, then we don't know they're sick. So if, people choose to go to one of these independent doctors like Dr. Galam or Dr. Haynes, is that something that you guys would be like information sharing or maybe
Oh,
creating
certainly, any data that we're collecting as far as the train derailment is concerned is there and we would share that information whenever it was appropriate.
Thank you, I appreciate it.
Gretchen answered most of your questions, but we would do the same testing if it was required. And we would work in collaboration with all of the physicians and share information once it's signed off by the patient.
Right.
So we would have the same services.
Thank you.
Okay, I have one here. So, you, I don't remember who's who, but, they were saying that there were, support groups that were going on, and I was wondering how that information got out to the community, cause I, during my time of total devastation and needing some counseling, I didn't hear anything about that. I don't know if are you doing it on, how do we find out? How does the community find out?
I think that is one of the biggest challenges that I've found is there's so many things happening and it's really hard to get all the information to all the right people. We shared that information through a variety of things. We did share it on social media, on Facebook accounts, on some of these Palestine websites. We handed out tons and tons of flyers at these Palestine street fair. We had a booth set up, Diana was there, and some of our other outreach people, we handed it out there. What else did we do, guys? we had the one group was held here in this building, and there was information here at the way station. The other one was held at the library, and so there was information at the library that was put out. I'm sure we missed getting all the information out, but that is something, again, we could use your input on what's the best way to get information.
I think the city should really be having one webpage to guide us in the right direction. They should have all the information in one place.
And they,
Their meeting at the same day.
yeah, and that is one of the.
It all needs to be in one.
We would agree, that's been one of the hardest things, I think, one of the hardest challenges is to get information to everybody. And I know that the city manager, the council were aware of some of these things too, but just to try to find one place to get it all is really.
We need a push from somebody other than us residents, because we are public.
And anything, again, if, any of us can help, I know all of us would be willing and would love to get our information out there to everybody.
Another question I had is you said that you are doing lab work. Can you give me an example of some of the lab work that you're doing?
Sure. The lab work that was recommended from the toxicologist for anybody exposed is what's called a complete blood count. You use your white count, your red count, your platelet count, your things that clot your blood, and then what's called a comprehensive metabolic count. So that's going to include all of your electrolytes and your kidney numbers and your liver numbers. And to have those checked, the recommendation is check them every 6 months for the first year, and then every year after that. And it's based on the patient too, so if a patient comes in and says, I'm having certain symptoms, then there might need to be other testing done.
I do have one more question. kind of helped compiling this data from all the different, from Mercy Health, et cetera, from Cleveland Clinic. Do we have anybody in charge of the data of what's going on health-wise in the city?
I can't answer that question for ODH, I don't know their information.
We're not doing anything wrong.
Yeah, so we're not gonna be the sink for that information. It's not gonna all come to us directly. Ohio Department of Health, probably their Bureau of Infectious Disease or Epidemiology is probably the place that would happen. It may also be happening with CDC. We talked about bringing all that before, and I think some of the speakers last week or 2 weeks ago, Mark, I think they talked a little bit about that.
Of different hospitals, I just can't speak to what they're doing with it, how they're doing it.
If
and
there's
where they're at.
centralized locations so they can study it.
Yeah, and, the representative from ODH that was there at one of the previous meetings did discuss how they were getting that information from the area hospitals on a regular basis.
And we do need to be working with Pennsylvania when it comes to that, because they're here.
Right, and there is that collaboration.
Yeah, we've seen it on the calls and some of the meetings that we've had, the connection between Pennsylvania Department of Health and Ohio Department of Health. The epidemiologists know each other very well. I think Kristen Dickerson was here last week, and there were 3 folks here from Pennsylvania, and so they're very familiar with one another. They work together all the time on other illnesses and diseases.
Robin?
So I guess this is for Russ, health department, I guess.
Yes.
So we had our well water tested the first time, but it's been a long time. Are we automatically on that revolving list? Because when it came out, I asked the health department representative, and she said she was from another health department, so she didn't know how to answer that question.
Yeah, that's a great question. I would have you call our office and talk with Laura. She administers that program for us.
Okay, so.
If you've been sampled once, typically they're gonna come back to your
Because
property.
we're in zone of concern too, so I was
You're in the area
curious
too.
why it didn't, so we have to keep the ball rolling, so every time you come out for a test, we should call and get on the list again, or?
Typically, they would call you back because we're on a cadence, so we're gonna come out every 60 days,
Okay.
based on the current plan, so it's gonna be a 60-day rotation. Depending on features, but they should have contacted you. The second round of sampling and the third round, typically they would contact you. It's not the responsibility of the property owner to contact the agency to do that work.
Okay,
Yeah, and they do it in tandem with, like I said, the Norfolk Southern contractor.
right.
So there's 2. I would have you call our office directly, and that way they can look
Is
at
that the
us.
number you gave before?
That would be the scheduling number, but if you call our office direct, 330-424-0272, that might be a little faster path.
Okay, thank you.
My first question is, who do we go about public health care complaints? We was sent to a couple different places, and we have not got the correct answer for that.
It depends on the type of complaint that you have. So if it's a public health nuisance, that would come to my
Or
office,
more or
at least
less
in
health
Columbia County.
concern.
Health concern, again, it's gonna depend on what your specific concern is about your health. You can start with our office. Typically, the best thing is to go to our website, fill out the complaint form, then what'll happen is our folks then will review it and make the referral to the appropriate agency.
Okay, I've been a sponsor for 10 years on addiction. I was wondering, with the relapse of some of the people that I've came across from this derailment, alcoholism, smoking cigarettes, drugs and alcohol, where can we reach out for that kind of treatment and help?
Yeah, that's a great question. I don't have any statistics on that, but we do believe and know that, individuals who have been through this, many of them have struggled with relapse and with difficulties, with their, whatever their addiction happens to be. So the best thing to do would be to call one of the agencies that treats substance abuse. That would include Community Action Agency, the Counseling Center, Family Recovery Center. Again, all of those agencies have services that can be covered through the grant. So if there's financial concerns, those can be taken care of. Hopefully, when the Resiliency Center is started up, we will also have some space for AA meetings or NA meetings or other kind of meetings in the community too. That's one of our goals, is to have some of those things available for folks. And you can always call our office and we would refer you, to someplace. All of those agencies and things are listed on this one handout here. There's a couple that actually they're all listed on.
Thank you, ma'am, I appreciate it.
I'd like to add to that too, that remember your primary care provider is an excellent resource too, to get you to those places that can help you. So if you're not sure, your primary care doctor should definitely be able to do that. East Liverpool City Hospital does also have a new vision program, which is drug and alcohol medical stabilization. So over a 3 to 5 day period, anybody who is suffering from a relapse that needs to come into the hospital to have more of a controlled withdrawal, we can offer that as well.
But nobody that is in active addiction is gonna do that.
No, this would be for people that want.
You know, we need, listen, I sit back here and if I'm not the only one that sees this, somebody has dropped the ball. There needs to be a uniform person that's doing everything, because people in East Palestine and surrounding areas are sick. I don't care.
And we're happy to be that person for you at that clinic that's right across the street.
Okay, but there should be some collaboration in people studying what's going on. I heard the CDC went door to door, asking about health complaints. Well, guess what? They went down Taggart Street, never came down my street and asked us what's going on. I'm very sick, and luckily I do have insurance, and I'm smart enough to find the resources out myself. I shouldn't say smart enough, but a lot of people that are homebound or don't have Facebook or have mental health issues, they have no clue. I think somebody needs to get like a one person thing and start.
Well, that is one of the goals of that clinic being there, was to be a center spot, to work with ODH to get you all the resources that you need. The resources may not all be in that one building, but the people in that building are able to direct you to mental health and to specialists and to whatever the case may be. So
See, we was gonna start trying to canvas as community members to go to some of these elderly and stuff.
Sure.
And RVO is a nonprofit, and the city wanted to charge them $400 per person to do it because of the vending thing that they did, the city ordinance. I mean, this is what we're fighting here, and we're trying our damnedest to figure this out, and we're not getting we're not getting no help, of course, from the city. They're worried about new parks and stuff like that. That's all fine and good, but there are some people out there, and we haven't found the pathway to the illness yet, but there are people out there that's sick. She has sores that she went and had biopsies done. She had CAT scans done because of this, or no, she has MG. She's getting all these testing done, and then after looking at these sores, they come back as eczema. That's the diagnosis she gets, or the diagnosis she gets for these open sores of blisters and stuff that we're getting, and we're 0.3 miles away from the thing. We can't even canvass in this town to help these people as a community, and everybody wants to, bash people and the stuff that's going on, when, hey, if you're not sick, thank God you're not sick. But there are some people that are sick, even if it's a mental illness or whatever, stress related, however people want to say it, they're stuck in their homes, and we can't even help canvass and work with you guys as a community because of the outlet.
And that's something that we can help with too. So if you know there are people that are stuck in their homes, there are physicians that go to homes, and there's an agency in this area that can do that. So that person has a primary care physician, that primary care physician could try to get them on that list so that the doctor can come to the house.
I think the problem is even getting to that point. What we were seeing when we were canvassing is there are a lot of elderly in this town that are in their homes that have no access to smartphones, that don't know what's going on or where to find the resources. Perfect example today, I went and picked up a couple of women that were literally screaming out their front door, someone help me, I'm in my house and I'm sick. You know, they're both on Social Security, they have Section 8 housing, they have no mode of transportation, and had I not walked by that door at that time and she didn't decide to yell at me, she would still be in her home. So I think the frustration that he's expressing is not from you, it's just from the canvassers not being allowed to go door to door. So I think if you guys have the resources and you're allowed to do that, you know, there are people that are suffering that don't have a way to use their voice.
And it's critical, this time that it's been 4 months and this is critical time. I go to an oncologist to find out if I have leukemia. My numbers were fine before February 3rd. So it's not gonna take months or years. I mean, this is happening now. You know, and trying to get.
And again, we've had 8 of these meetings, we've had 9 of these meetings, Mark, right? Not one city member has come to one of these. But it is a problem to me because, you know, they expect all this other things, they're going to the park, it's a city, you know, it's wrong that we're sitting here going through this and they're not hearing us as a people. They got their little cliques going on and this is what we have to go through, that we get charged $400 to go help people. This is messed up and this is why I want out. I've been trying and there's no way because I have a mortgage. We just bought a house 8 months ago. This is the whole reason. And this is the frustration that why people are, we started a unity council. This is why, because there's so much backlash that we get from the community that's in the clique and thinks it's okay or is afraid to say something because of the backlash. So, I mean, we're getting fought to walk our own streets to say, hey, do you need help? If not, go to the next house. We're getting fought for that.
Can I ask you a question? Who's preventing you from knocking on a door?
The mayor, the city has a city ordinance.
It says what?
No door to door.
No door-to-door what?
It
Communication?
was put, well, I don't know, maybe someone in the room has more information.
Have you
but,
heard about the First Amendment?
The ACLU was contacted, and when the mayor got the flyer from, I guess it was called the Watchtower, he thought it was Jehovah's Witnesses. But we have contacted the ACLU, the canvassers were stopped by the East Palestine Police Department, told they had to pay a $400 fee, and they had to.
For going to talk to their neighbors?
Vendor fee.
What are you selling?
Nothing, not even asking for donations.
What we're selling is trying to help people find out.
Yeah, I think that I'm a lawyer.
That's what we're selling.
Nick and I are appointed by the federal court to be liaison with the community here, so we're trying to attend these events. And that dog don't hunt.
It is happening. It is happening.
Okay, well, so there needs to be some other.
Right, I'll give you my contact after this. I mean, I'm not.
You can't prevent somebody from going to the door and talking with them. That's the First Amendment. That's just very clear.
And I agree with that.
And a city that is carrying on like that and preventing that is creating an additional liability to itself.
This is what's happening.
The woman that I met today who was yelling from across the street, we need help, we need out, with her 82-year-old mother, I could have possibly reached them, or someone could have, if we were allowed to be out canvassing.
You have an absolute right to talk to anybody you want. Okay, you're not selling stuff.
You wanna go canvassing after this?
I'm
Or at
just-
least give me your number, because I need it.
And Palestine, the city, creates an exposure, a liability to itself by interfering with that. They just do.
And that's what I'm saying, like, they won't help the community members that are suffering, but they won't allow us to help them either. So I feel like our hands are tied, and again, I apologize if this frustration's coming out on you guys, and it has nothing to do with.
Is there a legal services option in Columbiana County, anybody know?
They have legal aids, but you have to have a,
It's very.
yeah, you have to
There's
have
legal
a.
services, their offices are in Youngstown.
Yeah, they're on our county.
I was on their board years ago, but I have a question for the doctor, since I'm holding the mic. It was my impression that for at least a couple months after this, that the local medical community and the clinics and so forth did not have the expertise to deal with the situation. You seem to have suggested that at some point you were given some input from on high or some organization that gave you some standards to think about. But I think part of the frustration here is people go to the clinic and they've been exposed to many of them, to some pretty heavy duty stuff, dioxin and vinyl chloride and maybe phosgene gas and God knows what else. And the medical community didn't have the background to help them think about this, and so you get diagnoses that are, oh, you've got an inflammation and I'll give you an antibiotic and so forth. But it's more complicated than that, isn't it?
Very, yeah. Yes, so as a medical professional in this community, I certainly didn't know much about those things. I was the doctor that did about 90% of the work in the temporary clinic there. By that time, I got a crash course in that information, and I was fortunate enough that I had some toxicologists that were very kind to me and willing to take as much time as needed to answer all the questions that I had. And there were times I would talk to the toxicologist for an hour or more a day, because I'd see one patient, call the toxicologist, see another one, call the toxicologist, because that's what we do anytime in medicine. So if I come across, I didn't know anything about COVID when it hit, but then you start to talk to people that are experiencing it, and we got information from those people in New York who dealt with it a month or two before we did. So it's no different than any other situation. You reach out to those that know or that are experts in that field, which is what we did. So the folks that came into our temporary clinic, they were, in essence, when needed, being given advice by a toxicologist via me or whichever doctor was there. So, but the problem was we were not in a capacity to be able to draw labs and do those things. And if a patient did come in with a rash that needed a certain treatment, we were not in a capacity to be able to do that. And that's really why we knew that we needed to open the permanent clinic. But that was only one aspect of it. If you look at every primary care office within Columbiana County and the surrounding areas where the residents from East Palestine may go, didn't have that necessarily. I was fortunate that I had that. We all have access to poison control number that any doctor anytime can call and get a toxicologist. And we use them frequently in the ERs with ingestions and things of that nature. So any doctor has that ability, but you've got a doctor that's got a full schedule with patients that they're seeing, and then this happens, it's hard to be able to fit that time into it.
That's why we need the CDC.
They were told not to diagnose anything with chemical words.
I heard that, but I can tell you, as one of the doctors that was in the center of all this, I never was told by anybody not to diagnose it.
Yeah.
Okay,
Yeah, Mercy
all right.
Health is
So-
also the one that was told not to test for vinyl chloride anymore.
That would be, if that's what happened, then that would be a decision within an organization,
Right.
as opposed to the CDC. And just to be clear, and the lawyers can correct me on this, there are regulations of what can and cannot be said to a medical professional. I work for somebody, but that doesn't mean they can necessarily tell me how I have to treat a patient, if I might be correct on that. So you can have some guidelines and you can have some suggestions. So that may be the case with Mercy, I don't know, I didn't hear
Right.
that, I don't work for them,
I saw the
but
memo you're talking about. What it was, if I'm talking about the same memo, it was actually put out by some organizations, some high ups, poison control was one of them. Are you talking about that memo?
Yeah,
Well,
there's
it was
also,
two
I got the
pages, and
report,
what it
this is the first
was,
one.
it was, I read it, so it was clinical guidelines to guide local providers and clinics as to what was appropriate or not. And what you're talking about, I think, was in those guidelines, it was talking about it's not appropriate to test for the thiodichloric acid as a metabolite of the vinyl chloride, because at this point, we're not seeing it on the air monitoring. And I was really upset when I read it too. but it was clinical guidelines, so no doctors are forced to
Yeah, it
ever
was just
follow
Mercy
those
Health.
guidelines. It's like the CDC saying, okay, this is what we think you should do with this, and the doctor's like, oh, well, I disagree.
So I went
They're
into
trained
Mercy Health
clinicians.
and.
I know the lab's doing it, I'm appalled at Mercy Health, and I'll go right on record saying they should be ashamed of themselves.
Well, I got them on record on an
I
official
saw it.
video saying that the CDC set these guidelines. So then when the CDC came in here the last time Mark and them brung them in, they said, oh, we never did that.
But I'm somewhat critical sometimes of the medical agencies and the mental health agencies just because of where I'm coming from. But I will say that her clinic right there, they are doing the chemical diagnosis. I can share that because my children and I have all had that exposure diagnosis. So I'm happy to see that. That's been in the last month that that diagnosis started to show up. So I went there expecting like to have to fight for them to listen to me, and I've never had to do
That's
that. In
what
the
we're
beginning, they
thinking.
didn't really know what to tell us, but since then, I've not seen anything. So I don't know if that helps clear up that document, but I believe that's what it was.
Yeah, I don't
It
think
was
that
clinical
was.
guidelines, and I still disagreed with the guidelines, but it
Right,
helped
no.
me to figure out, okay, this is this agency that I really disagree with anyway, telling people what should or shouldn't happen, or what is or isn't appropriate, but every physician can decide that for themselves, so I don't know if that helps or
No,
not.
it does, I appreciate you saying that, because I quit going to the doctors because 3 times I've been on antibiotics and steroids and told I have an upper respiratory infection.
Right. and I-
46 years old, I've had them before, I've never had one that I went through 3 rounds and still have it.
Yeah,
And
I've
that
gotten
lasts
back
3
here
months.
through this, but I have to say that they're doing a real great job up there now, and I can't.
Okay,
find
wonderful.
anything
I
better
Schedule an
than
appointment
this.
with you. I'll be bringing some other people to you too.
Okay, that's.
Come Friday, I'm there.
Sorry, I didn't mean to answer that, I just thought maybe that.
No,
might
that's
help to know
helpful,
where that
I
memo is
trust what
coming
you're
from.
saying, you know, as
Yeah,
someone
I
in the
still think they
community.
were wrong for writing it, don't get me wrong,
Right,
I
no.
still hate those guidelines, but it's helpful to know that each individual person, now, it takes a doctor or a clinic of excellent moral character to fight against it, right?
Right.
Because there's all this peer pressure to do what the
Right.
agencies want, but they're free to do it.
You know, it's
So-
not even a diagnosis of chemical exposure, it's, what do we do now that you're sick? Who cares if it's chemical, we know it's chemicals, but treatment, like,
Well, the CDC said they can't treat for vinyl chloride, they can't treat for benzene, but they can treat for the cancer that is caused from these. That's what exactly came out of their mouth. So that ought to tell us something.
Question I got, Doctor, I was glad to hear you say about poison control, because Dr. Ann was one of the ones that came in with the CDC, and he said that there is a medical toxicology clinic, not in Ohio, but one up at UPMC in Pittsburgh, but you need a physician referral.
It's very
And-
similar to any other specialist you would need to send a patient to.
And he said Dr. Abasamis runs it, but if they come to the clinic
Yeah.
and they need further testing, can they then get a referral up to?
100%.
Okay.
Yep.
All right.
Or if somebody comes in and
That is
does,
so, thank you.
and you would need that too, if one of your complaints is that you've had 3 respiratory infections, at that point, you need to have respiratory testing done, and you need to see a lung specialist.
But that clinic's excellent up there, right, for testing for these type of
Yes.
incidents?
It takes
Yes,
a really long
and-
time to get in with this many people, that's the only
It
unfortunate.
really won't, we're pretty well staffed, yeah. Yeah.
Okay.
And then if we don't have that specific service there, then we can refer and make sure, but we don't just give a number and say, here, best of luck. You know, we're gonna make that appointment for you and make sure that it's set up.
I actually went to Mercy Health last week, and this is the first time since the derailment. I also had 3 sinus infections that just happened. And I have fluid in my ear from inflammation, and she said possibly because of chemical exposure. That's the first time I've heard that in all this time.
Well, from the moment we opened our clinic, that has been our diagnosis because that's what shows, that's actually how we define the patients that were exposed, so.
So the inflammation seems to be a big thing that's causing a lot of problems.
Well, you know, anytime you're exposed to something, you can have inflammation from it.
Gosh, am I dreaming? There's a doctor that's not gonna fight us. Like, no, I'm like, someone pinched me, like, people are just so tired of being fought by their own physicians. We're all gonna send people to you. Right, and sometimes physicians that have been our physicians since we've been 3 or 4 years old. So to hear that you're not fighting and you're actually acknowledging That we've been exposed? Thank you.
A lot of it is time to go through those tests, and in particular, some people that have vinyl chloride testing that's been done. I've learned a lot about vinyl chloride in the urine over the past few months, and so a lot of it is just being able to sit down and discuss the other ways that can come from and the values that matter, and getting that toxicologist on the phone, or getting you to the toxicologist. Because if there's any way that this is something less concerning, you want to know that, so that it does decrease some of your mental health issues. Yes.
Are you testing for dioxin?
There actually is no lab that I can find in this country that I can send samples to be tested for dioxin. They do test for them in certain labs, but it seems to be with research or in larger industries. But as a physician, I can't just send a sample and ask it to be checked for dioxin. If there is one, I'm not familiar with.
Research us. I mean, we know we've already been exposed, and, you know, like Linda Murphy said, if we're gonna be lab rats, do it right. We don't want anybody else to go through what we're already suffering through. So, you know, that's all we want, is we want it done right to help someone else. If there's no help for us, then just be honest, you know? I'd rather have honesty and the truth than the not knowing, you know, not having the answers. That's what the mental part of it is just living in limbo constantly.
I think I mean, I shouldn't speak for everybody, but I think I can speak for everybody here that we completely empathize with what you're saying. It's a very terrible situation to go through. I'm a resident of Columbia County. I'm in Lakewood, so, you know, I'm further away from that kind of concern, but it's still very concerning. You know, I have a farm, I have animals, what about them? And I think it goes to everybody's mind, when you're all right here, I empathize with what happens there.
You wanna ask them about exorectal?
Yeah, well.
So I don't know if this is the right forum, so I wanna see if you guys are kind of putting your heads together and think about an issue that I think we've all kind of expressed, is that, listen, help is not coming from city council or from this mayor, and I don't care if I'm quoted saying that. They are not gonna do the right thing. So there's a sharp divide, and at this point I say, let them do their thing, but what would you say to us residents that have to try to come together, that the residents are so divided, like sharply divided, like say the wrong thing and somebody's gonna rip their head off on either side? So are you thinking of ways that you can try to get the message to this community that, hey, your neighbor's sick just because you're not, or hey, we're sick but just because they're not, you know, to kind of bring this community together? This is very fractured, and that's been making everything worse. I mean, I know that's a tough question to throw out there, but I mean, you try to get the leaders that are gonna help, but when they're not, you still have to move on. And it's very hard to do in such a divided climate. I mean, I don't know if there's a response to that, or if you guys are thinking of any kind of community outreach for fractured communities like this.
It's
a thinking question, I guess, right? It's a thinking point, but I think it's worth thinking about, because it's really stressful. Sometimes you're afraid to ask questions because this person or that person is there, from both sides. I am not taking one side or the other, you know.
You're asking about social science.
I know.
I think, yeah, definitely it's something to think about and to plan for. Robin, I know one thing that, you know, I went to the council and approached them about a option for a coalition building group to come in and kind of help to bring all the different entities together. And because of some of the situation right now with the council in terms of not having a permanent village manager.
Oh, Norfolk's finest one, we're good.
I think that, you know, they're hesitant to start that process right at this point in time. But there are definitely some things, and I can tell you, one thing I can say is that the local people really work well together. I think one of the things that, you know, you have that's going on right now is there is a lot of people involved, you know, federal, state, you know, local, and at least on the local end, I mean, all of us communicate, you know, we are in meetings together all the time, you know, so if we can do some things on the local level, you know, we will definitely try to come up with those things, and we'll support anything we can. You know, we can't control, you know, what happens at some other levels, but we'll certainly, you know, be there, and you're free to call any of us. Thank you.
I have a question. I'm gonna change the subject. When, the last flyer that came out, it said that American Legion's water was tested and it gave this blah, blah, blah answer. Can anybody clarify that?
False.
Jen, you wanna clarify?
Yeah, we researched that, as Unity Council. I actually yelled at my brother and says, don't post that until we research it, because, right, it was an ad. The people were trying to sell water filtration systems. You know, it wasn't a battle that I was willing to fight right now with all the other battles. You know, people putting out that false information. So I'll speak for Mark Bruno when he says verify. Right, Mark? Verify.
Yeah, they spiked the water samples with vinyl chloride to see if their filters will take out vinyl chloride.
Exactly.
So yeah.
Right.
So what we did is we asked Ohio EPA as well to research it, and they contacted the company, and I guess based on multiple fronts, the company took that down. They spiked the samples in there now.
Just to see if the system would get it out. So it wasn't saying there was vinyl chloride, it was saying if there is, the system will get it out.
It's just the way it was
Right,
worded.
exactly, but it made it
Oh,
look
no,
like.
yeah, we all freaked out when we saw it.
Yeah.
Trust me, we all freaked out when we saw it.
Do you test for dioxin in the water test?
No, that's not one of the, no.
But when you burn vinyl chloride, you get dioxin.
Yeah.
But you don't test for dioxin, and it's got a half-life of about 80 years.
Yeah, so, like we talked about the last time you and I discussed dioxin issues, we look at the priority contaminants, the ones that would be most likely to get into the ground at a higher rate, and we look at those priority contaminants first. If priority contaminants start to spike, then we'll start.
Where did you get the list of priority contaminants?
Look at our potable water sampling plan on our website, on US EPA's website, and there's a list of 29 priority contaminants.
In what circumstance?
What do you mean?
Well, if you burn vinyl chloride, you get different types of dioxins.
Right.
So you can't have a one recipe fits all chemical spills because there's an unlimited number of chemicals.
That's right, there is an unlimited number of chemicals, and that's why we've narrowed it down to the priority contaminants that we would expect to be either present or generated.
From what type of spill?
The spills that occurred at the derailment site. Now, I've got our environmental unit, we got a series of experts that have gone through, reviewed all the science behind it, and this is the list that they came up with, so.
I think you're confused. If you haven't been at the other meetings, your barbecue.
I was at a few.
Yeah, your barbecue grill will put dioxin in the air, but that big barbecue over our town, it didn't do it.
Oh,
I just wanted to make sure you knew that.
It did, Jamie. We all know that it did.
Right, we know that it did.
But again, it's about the levels and concentration, and again, from the samples that we've collected in soil, and we've talked about this before, you know, we're not seeing a heavy dioxin burden from the spill. We didn't see a whole lot of phosgene or hydrogen chloride, even though we saw it in the environment.
How do you know there's no dioxin if you're not testing for it?
I didn't say that.
Oh.
We were testing for it.
Oh,
We
oh.
have seen it. All right, actually, let's look at it from let's look at it from a different perspective. In the waste, right? That's where you're gonna have your highest concentration of that particular chemical. And we've seen that particular chemical between 700 and 900 parts per trillion, okay? That's even below our highest residential.
Yeah, we know that.
The 1 part per billion. So, again, there are probably 100 chemicals that were created. We're focused on the chemicals that have the highest probability of transport and the highest probability of impact. So, yeah.
How many hours a day is that bus running for the air quality testing?
The analytical bus, the PTRMS and the TAGA, those run as long as work is active, they run. Now, at night, they do not run.
So are they testing for like industrial levels, like the time you would be exposed, like say, for example, if you worked at a vinyl chloride plant? as opposed to, you know, people that are getting exposed 24/7?
Yeah, those, can't think right now, action levels are set below the 20 part per billion, lowest exposure level, based on the risk assessment that was done by ATSDR. So we can see it at those levels or less, so 20 parts per billion is that.
Based upon a risk assessment that was done by whom?
ATSDR, the Agency for Toxic Substances and Disease Registry.
EPA is not doing a risk assessment, right?
Well, you're thinking about something different, so it's,
Oh, okay.
it's actually a health consultation, so I used the wrong language, it's a health.
So are they accounting for all those different chemicals? That's what I keep asking, because,
Yeah,
you know,
and
if it's
and
below reportable levels of
exactly, and
35 different
right.
chemicals.
Yep, yeah, we've talked about that before, and that's where the research piece of this comes in, that's the reason that, we brought NIH into the mix, and, there's gonna be.
So it won't be looked at until later.
It's not being looked at as an 8-hour, is it looking at as a residential, or is it looking at?
That's what I just asked him.
Yeah.
He said it's at a residential.
Yeah, the levels in air that were measured.
Because I got my
are
sample,
at residential.
sample back from my house from, JSO, and one whole page is, I had toxicologist look at it, the benzo, the RDL, which don't mean too much, is 0.03. The chemicals that are on just one of 72 pages is nothing but carcinogens, and they're 10 times higher than the RDL.
Okay, we'll take a look at it.
Yeah, like I said.
We'll take a look at it.
Yeah, so I would like to see about, you know, what's going on in my home with the benzos, the fluorine. There's so much in our home right now, and I don't know if that's what she can.
Okay. Quick site update. You probably saw this, the newsletter arrived today. Did you guys get the newsletter today?
It'll be in the mail tomorrow.
It'll be in the mail.
We do have some copies here.
I don't live in town anymore, so what do we do?
Okay, well, so there's,
That's the sign up sheet.
I can email it to you, Jamie. I thought you wrote.
My email is so crazy right now, I'm not gonna lie.
We do post it on the website.
Okay, I'll check it out
We
there.
post on the website every Wednesday.
Yeah, so long story short, so the last bit of contamination under the tracks was excavated yesterday. That was just west of North Pleasant Street. That's been confirmed clean. We excavate to groundwater standards. It's been confirmed clean, it's been backfilled. That track was being reestablished today. I'm not sure if it's finished yet. By the end of this week, we anticipate that both tracks will be active. So that's the track.
They had both tracks active yesterday.
Yeah, they were. You're
Okay.
right. But it would have been 2 days ago, actually.
Okay, maybe
Yeah,
2
it
days.
would have been 2 days
Yeah,
ago.
okay.
But yesterday is when they started.
What are they
digging,
doing over
and
the
then-
park?
Okay.
But hold that thought. So let me finish and then.
Yeah.
Um,
I'm sorry.
Yeah, no, it's good, it's all good. So, on the north of the tracks, where all the burned out tank cars were staged, that's the next step. So starting tomorrow, they're gonna start scraping that material, probably take about a foot of soil. Stage it, get it prepped for removal, and then we'll visually inspect it. If it looks clean, then they'll start the sampling process. If the samples come back clean, it'll get backfilled. If not, it'll get another foot of them. So that's what's happening north of the tracks. We don't anticipate that to last too long because we know there weren't any active spills over there. It's just where those contaminated tankers were staged.
Mm-hmm.
After that's done, then we move south of the tracks, near the Saramfab facility. We know that there's some pockets of heavy contamination in there, so.
Is it coming down?
What's that?
Is the impact coming down like that?
I hope not, but we'll see. I mean, that's part of the
We all
investigation.
heard it was. Yeah.
How do they get under that?
No, what you guys have been seeing is sheet piling is being driven to protect the railroad tracks and then also protect the foundation of that structure.
Okay.
So it's not coming down. Actually, those are protective sheet pilings that's being put in to make sure that the building isn't damaged from the excavation work that's going on. Yeah. So the next step is figure out where the contamination is migrated. If it has migrated to or under that particular facility, then decisions will have to be made based on that. But we'll see.
And then will you look at State Line Lake?
So
What's
State
the
Line,
condition of that?
well, State Line Lake was never impacted. And so we've been sampling the water coming off of State Line Lake, and we haven't seen anything.
Mark, when is the full site assessment? Because they've not done a full site
You're
assessment,
exactly
right? So I
right.
mean, we're there putting this
So
contamination on
that-
the railroad tracks, but we don't know how far it goes or where
Yep.
it's at. I mean,
No, great question, Robin, and
I guess I'm disappointed.
that plan still has not been approved. We've been talking about it for a month, and we still have not approved that plan because it hasn't met our
Is that
requirements.
normal, Mark, in these situations, or shouldn't they assess the site before they're 4.5 months into cleaning up the main contamination?
No, not necessarily, because, you know, we started this under an emergency umbrella, okay? And so it was, you know, it was get in, write we call it the mainline track removal plan, write the mainline track removal plan that did include bottom sampling, you know, to groundwater standards. So there has been an excessive assessment just underneath the tracks in the center line.
No, I know
But-
about the work
yeah.
plans and the assessments
Yeah.
gone, but it seems to me you would do an overall site estimate to
So
see.
we've had that plan in the works for a long time, and again, until we agree on how thorough that assessment plan is gonna be, which may include more
Who
dioxins.
we agree? Who we agree?
EPA and our partners, all
The Norfolk Southern and,
so Norfolk Southern's writing the plan. We will not.
why aren't you guys just telling them what to do?
Well,
That's
we
what I
did,
don't understand.
so that we directed them to write,
Right.
to develop a plan.
But then it's negotiated?
And
Is
then
that-
they develop a plan, we send it back with comments, and we've been going back and forth. Now, we also have our partner agencies look at it, Ohio EPA looks at it,
But-
other partner agencies that have investments, ODNR for the surface
I
water.
understand, but my concern is the passage of time, because this is a rough draft, no kid, you have to do more detail here, here, and here to assess the site, but we're living here during that time, so it seems to me like if we're gonna make a plan to clean up a spill, we better know how far the spill is before we start.
Or when can people get back in their homes? Like, you know, that's the
Yep.
thing.
Yep, your frustration, I share it. I share it.
Okay,
Because
I mean, I think it's really hard.
I've wanted this plan to be done.
Is there a limit legally that they have to make an I mean, we're just talking about, so they could do this assessment, and there could actually be contamination found further up the railroad tracks, right? Possible?
It is gonna be assessed, yes.
So it's
Is it
possible.
anything's possible.
Right, because they never sampled out to find where the margins of the contamination was. So I mean,
We're stewing in a chemical soup.
well, maybe not, maybe, I don't know, my
Right,
point
yeah.
is, it seems like at 4.5 months, like, when are we gonna establish the boundaries of where this pollution, at least on the ground
Right.
or in the water, you know, the air is harder to call, but
I 100% agree with you.
is there a limit legally, like, do
So
they have a certain
in
amount
the
of
order,
time?
in our administrative order, we gave them a deadline to submit the initial plan. That's the only deadline. that's
Oh, so they can go back and forth for,
It won't, if we do get to a point, that there just is an impasse, then we will order the work directly, so.
would you do the site assessment before, if it comes to that point, to see what
We'll
you need
see.
to order the work?
Yeah, we'll see.
Well, I just wanted to get that out there, because I know that's a really hard and frustrating part, is how do you clean up a mess when you don't know where to stop cleaning, you know, because.
No, I get it, I share your frustration.
Thank you.
100%.
They don't even know what
Thank
to clean our houses with, let alone.
Maybe they'll tell you that when they're done assessing. I'm sorry, I try and not be so bad.
And the rivers,
I
the river assessment as well, same thing.
Well, the creeks will settle for first, because.
That's what I meant. That's what I meant.
I'm gonna ask this question when I was here because I went down to EPA office early. I was down at Sulphur Run when they were doing their sediment cleaning, I guess, where they're starting. They're only focusing on the bottom, like where the water's at. Why aren't they focusing on the side where the most contamination is at?
Yeah, so that's part of the assessment plan as well, to assess the sidewalls and the river bottom. We don't wanna start undercutting the creeks, okay?
Yeah.
So that's a big part of it. That's the best answer I can give you right now,
Okay.
until the assessment work is done, and
Okay.
we come up with a remedial.
Okay, so it's still ongoing, still.
Yeah. Oh, yeah.
Okay. All right. Thank you.
Yep, Jamie?
Something important to tell you. So I was rewatching the videos from the, CTEH toxicologist that came into my home when, you know, I was initially told that they would move me and get me out of there. And at the time, the word didn't mean anything to me. But rewatching that on my way to Columbus, I noticed a couple of things. First of all, I was asking which chemicals were in the creek. And, we said we haven't even seen a manifest yet. I guess I didn't realize that.
So this is, you're talking early February?
Yeah, I'm talking, this was February 14th.
Okay.
We didn't know what was in the creeks. When I asked about water testing, they told me that it had been done, but the results had not been released yet. When I asked them about soil sampling, they told me that they were not doing soil sampling because the EPA didn't feel like dioxins were a possibility. And then the only thing we had was the air testing, which we all know wasn't really air testing. So when we were told it was safe to come home by, I'm assuming the EPA had something to do with that.
You were part of the process.
Yeah, I mean, I usually trust my government, but I'm telling you, when I saw my creek, I didn't. But, none of this testing had been done, yet they were telling us it was okay to go home. And the words that I picked out was something that you always use, this pathway to exposure. What this guy from CTH, he was a lead toxicologist, I have his name in my phone somewhere, what he said when he saw the water running down my basement wall, which is exactly what this gentleman is talking about. There's those embankments on both sides. So all those chemicals are leaching into the side of those hillsides, and that water is leaking into my basement. It's not overflowing, it's just going through. And he said this is a possible pathway to exposure. So he used that term as early on as February 14th.
Yep.
So has there been testing done in people's basements that have this stormwater leaking into their basements?
The answer is no, but there is a possibility because, again, that's part of the assessment, the overall river assessment. Right?
But you're right, but when he used that word, pathway to exposure, I'm like, this is February 14th. If they knew that this is a potential pathway to exposure, when you can ask most realtors in town, our storm drains are so bad they have to do a dye test before they sell homes because these storm drains, leak into homes and basements. So on February 14th, when CTH is telling me this is a possible pathway to exposure, why wouldn't they at least check all the homes along the creek?
That's a good question.
And then my other question would be, this runoff. We all saw the rainbow water running down our streets after the first rain, so even if that stormwater is not leaking into your house, what about people that all that rainwater ran off of their houses into their yards? So when we're talking about this pathway to exposure, I guess, my biggest question is why weren't they looking at it when they themselves, CTH, use that word? And if we're all searching for this pathway to exposure, why wouldn't they have done that? And my second question is, I know you keep talking about, finding this pathway. Do you think it's there?
So.
Yeah, it has to be.
So.
I'm asking,
So
right, I know my opinion, but.
Yeah, but it depends on which contaminants we're talking about, right? So the volatile organics are going to, they're going to off gas quickly, right? And we know that. And that's been one of the, areas of, I don't want to say disagreement, but, we've been doing extensive outdoor ambient air sampling, right? And we're not seeing the contaminants of concern in the outdoor air. And we would not expect the indoor air to be contaminated either because with those, well, hear me out, Jimmy.
Right.
Hear me out. With those particular contaminants because they're volatile, they would have been long since gone by now. Now, for those who may have had, water or sediment infiltration from the creeks, I think there's some validity to investigating this. And we've been talking with our team about that because we know that here in another month or two, we're gonna be getting to the point of whether or not it's appropriate for those that aren't in their homes to come back. So we're actually talking about this right now.
I should never have been here.
But
Never came back.
again, the volatile organics, we wouldn't expect to see.
But because what he was saying, and maybe you can answer this, was if that water were to puddle in my basement, it would release vapors. And that's when I asked him, well, who's doing the air testing in my house continually? So when you're talking about not expecting to see different levels in houses than you do outside, if these chemicals are in their basement, there could be different levels. And it could be explaining why some people are sick and some people are not.
If they are, right, right. I'm not gonna argue that point.
So, when we asked the mayor for a map of the storm drains, we were told that the only one that exists is an old one that Gary Clark everybody knows who he is in the room, drew with a crayon that's down on the wall in City Hall, and he was apparently too embarrassed to take a picture of it and send it to us. So even, you know, knowing where those storm drains are, knowing which ones are really bad, leaking into basements, leaking into yards. I mean, I know you said.
Oh, I saw one this week.
Right, and you said we don't really need to test the storm drains, cause all that water goes into Sulphur Run, and we're testing Sulphur Run.
Well, and I was talking about the air quality of those storm drains, not necessarily the
Okay,
sediments.
gotcha.
Yeah, I was talking about air quality specifically.
With them walking through the creek at the entrance to the park, I don't know what they're doing down there, there was back trucks and stuff. I took a video, of the chemicals coming still up out of the creek right there, while kids are walking past and swimming at the swimming pool. You say that they go up into the air, they dissipate. Is there a health risk for the kids walking right beside that creek while they're walking through it and pumping and doing whatever they're doing down there?
Are they actually going into the creek?
Oh, they do.
It's smelt down there. You can smell it.
Yes.
I ran kids out of grease.
So I didn't know if, since, you know, the chemicals are coming out, they're obviously going into the air, we got kids walking to and from the park, they're all up there swimming while they're doing all the work at the entrance of the park. What do you feel about that?
Well, we sampled during, we air sampled during the heavy sediment washing and air knifing that was going on down there. We never saw any levels away from the water. There were levels of concern in the air. We wouldn't expect to see that now, this much time in the air. Now, they shouldn't be in the creek because, you know, there's potential for exposure there. So, you know, that's happening, then we'll make sure the city's aware.
Because you haven't assessed the creeks yet, right?
No, we haven't assessed it, we do have data from.
Right, but it hasn't been overall, I'm not being smart, I'm just asking, they haven't been assessed.
No, that plan has not yet been approved.
Thank you.
You're a fact checker for when we hear stuff, we need to call you to check the facts. So I'll make sure everybody has your number before.
No, you have my number, so.
No, because you are helpful. There are times, you know, when I hear stuff and I don't know what to believe, so sometimes it's nice to call and say, hey, Mark, why are these people in the creek? You know, because 20 different people have 20 different opinions of, you know, they're down there.
Well, they've been there for the
playing
last 3 or 4 days.
Yeah.
You know what I mean?
I was down there 5 hours today. I spent 5 hours down there today while they were cleaning. So,
And I know they were persistent all day yesterday.
yeah, they were there yesterday too, yeah.
And yesterday they were in full gear, like full,
Oh,
on
yeah.
PPE, like, you know.
I was swimming up there, but.
Right, right. It's okay to be at the pool.
Again, you know, even when the contamination was a lot heavier, we weren't seeing anything.
Okay. I got hit in the face with one of those, aerators. I was standing next to it, I didn't realize that it was turned on, and they turned it on, and I'm telling you, it smacked me in the face like a invisible wall of smoke, and I didn't have a voice for a week,
Oh.
so.
Okay, well, we've, I think, used all our time and then some, so Phil, oh, it's all good, Jamie, thank you.
Yeah, I was just gonna say, thank you all for coming. I hope this was helpful, and, yeah, feel free, you know, to come up to us afterwards, we'll hang out for a bit. And we're planning to do another info session in July and do a broader operations update. We don't have a date yet, but that's the plan, and then if there's anything, you know, if you want us to do another sort of health session or anything else that y'all think would be helpful to do in July, let us know and we can get that planned as well.
Can you just get us all their contacts in the flyer next time?
Oh, in our newsletter?
Yeah.
That's a good idea.
Yeah.
And if you guys wanna, yeah,
That's a good
give me
idea.
your contacts, we're doing a newsletter for Unity Council. And we also are starting a page of links to like all the different health studies. If you guys have links, you know, it's kind of a resource page we're trying to create. So, thank you. Thank you guys so much for being here. The fellow Columbiana Countyans.
Thanks, everyone.
Yeah, thanks.